Hello and welcome to our interview today. My name is Marianne and I welcome Dr. Mini Mehta from New Delhi. Very happy to have her here today. And yes, could you please introduce yourself a bit and tell us a bit about yourself and your clinic, your work?
Okay. Hi everyone. I feel really honored to be on this show, and my name is Dr. Mini Mehta, and I'm practicing homeopathy in New Delhi, India, and practicing this homeopathy from 2009, and I became a homeopath just because I wanted to be a very good doctor. I was very much, I used to feel uh, very passionate about this field because I was a social service kind of person since childhood. I used to see doctors helping people. I used to feel I have to be like this person. When this person comes, everybody's problems get solved and they are relieved. These people are, uh, I just want to be a doctor. So I wanted to be a doctor. So in Delhi, we I just knew MBBS as MBBS allopathy as doc. If you want to be a doctor, there's one kind of medicine only, that is allopathy. Because I used to see those doctors, but it was about this kind of service. So here in India, there is an exam. So I also give that entrance exam. So my father told me if you get an admission in the same city, then it's fine. Otherwise, you don't do it. So I never wanted to waste my time. I was very disheartened. I did not get through that government exam, but I always wanted to be a doctor. But still, I joined, botany honors, botany. I
Mhm.
was confused whether I should join botany, zoology. I'll be a, something bioengineering I'll do. But still, I wanted to be a doctor. So then I came across all these alternative therapies. So then I decided that I'll be an alternative medicine doctor. So I chose Ayurveda. I did not choose homeopathy because I never liked it. My father used to take homeopathy for allergies. Then I used to yell at him, why do you keep on taking these medicines? Nothing is going to happen. There's no evidence. What are you doing? So I went for Ayurvedic medicine, the Indian
Mhm.
system of medicine. But, my decision was so late that I could have got it, but the admissions were closed. So
Hmm.
I then only one thing, I just gave one entrance exam for this BHMS program for University in Delhi. I got it in that. So then I had only one line, one this alternative system. So I thought I just want to be a doctor. So let's see what the system has to offer. So what little it can do for the people, I'll do it. So I just joined it. I was very confused and I had no belief in it, and just to become a doctor I joined it. But
Mhm.
I thought कि if there is something good in it, I'm going to take it to the top, and if it is a flaw, it is something false, I will be the one to stop it.
Okay.
I'll fight to stop it down, that there will be no name of homeopathy. With this thought, I joined it. So, before joining homeopathy from class 10th, when I was 15, 16 years old, I used to get acne on my face and I took every allopathic medicine for that, and it grew worse and worse and worse. And I gained weight. So I was suffering from that thing also. And that body shaming and that acne somewhere was affecting my studies when I was studying.
Okay. Yeah.
My self-confidence at that time. Later on, I realized what was affecting me, my performance everywhere. So when I joined homeopathy, I was studying it very with a very critical, mindset that I'm going to find out everything what they're hiding, what bluff they're doing. I will find out. So, when I joined it, I was reading it. I read Organon. It was very difficult to understand because I had a critical mindset. But when I was reading in second year, I was reading and I was dumping my books like this and that. One guest professor of ours, he noticed me and he said, "Why don't you take chamomilla 30?
Uh-huh.
One dose you have to take. All your problems will go off, your acne and everything." I said, "Just leave it, sir. I have tried so many medicines from other doctors in the hospital. Nothing happens." Then he said, "Okay, we just try." Then I took it one dose, and after that one dose, every week I started improving. And I was feeling so bad and angry about it. Why I'm improving? So all those problems which started before they started appearing, new were the new problems, like if I was suffering with something else, acne was disappearing, the itch in my foot was coming, then I that previously I had some corns in my soul, they appeared and went away. This kept on happening for another 3 months. With that, it initiated with that one dose, that he that professor had one class in a week, and I tried to miss it out when it was looking much better on my face. I never wanted to show him because I resisted, but that created my interest in the books, and I wanted to read everything, how it can happen. Then I started reading it, and from the third year I joined that homeopath in his clinic to learn more. So I started, watching him prescribing and reading that with an intention to find out everything. And meanwhile, I was very suspicious. I joined an allopathic doctor also in the evening to see what he is doing. Then there was a major difference in the OPD. When the people were coming with diarrhea or fever with lot of bodily complaints, my homeopathic doctor was able to give them relief faster than the allopathic doctor.
Of
So
course.
here my mind, so here my mind changed that in the acute diseases, homeopathy is, getting more, much more better results. Whereas I could see in an allopathic OPD that doctor was saying, ma'am, you are mentally affected. There's nothing, no problem in your body. Look, your fever has gone down with paracetamol, and still you are, saying, I am having this problem, doctor, this and that. I think you have some psychic problem. But in that field, they don't realize that the symptoms, mental symptoms, how patient feel about himself is so important. And here the patient was coming, and he was telling the doctor, yesterday I had 103, I was having problem, but now the fever is 100 and I'm fine. I know I'll be fine. Fever was 100, but mentally the patient was so peaceful and confident in his doctor. So that was a kick to my mind, and then I realized, oh, I'm on the right path. Means I was chosen to be a homeopath because the way I wanted to help people, I'm on it. Now I won't leave any stone unturned to, be a good doctor. So this is how I was working. Then then when I was assisting this doctor, I learned a lot. I started practicing homeopathy in my relatives. Anybody who was sick, I used to, snatch their reports and tell them, you just take my medicine for asthma, allergies. I was, because I was so, I was not, I wanted to know the results. If I'll give the medicine, what will happen? Then my mother was asthmatic. And one day we got to know that after taking so many inhalers, her lungs were working 25%. Just with arsenic, I started with arsenic. And, you know, from that time, from 2003 and it's 2024, she has not taken any allopathic medicine. She was on
Great.
homeopathic medicine and she's so fine, her episode reduced. And you won't believe, then I found a cardiologist in New Delhi, and he was a very renowned cardiologist. And his name was, he was president award was given to him, Padma Shri award in India. His name was Dr. KK Agarwal, and he was a storm in the COVID time. He was telling people, making them aware about everything. He was a most renowned doctor. So he used to believe in alternative system as well. He was the best doctor in allopathic system, best cardiologist, chest specialist, and also he was the believer of alternative system.
Mm.
So then I got in touch with him. Then he told me, Mini, there are a lot of heart diseases which have good treatment in with homeopathy. When the patient comes for the first time with hypertension, you need to treat him with homeopathy, then the pathology will never grow. So with him, he used to choose patients for me and give me, and I was allowed to practice, and I used to get results. And I used to see people who take steroids, what happened to them, and where the allopath says, now I can't do anything. There I used to start. So along with him, I worked for 5 to 7 years, and I learned a lot. It was, manifestation. You want to be a good doctor. I was slowly becoming a very, good doctor, without any needles, good to children and elder people. So there were lot many elderly people. who were, who were on 13 pills for their cardiac problems, and they just came to two medicines with homeopathy. You know why? Because in homeopathy, we have our beta blockers, we have our ACE inhibitors, we have our calcium channel blockers, and they don't even, calm your body on the pathological level. They calm your body on the mental levels even. You pathological medicine, your mother tincture, with a constitutional remedy, your patient is on the great palliation if there has been a structural change to the organs. So this is how I learned under his guidance, because patients were safe because I was connected with him. So whenever if something is going wrong, he's there to check on it. So
Mm-hmm.
I was lucky. I got both the mentors, very honest, very good doctors. The homeopath I followed, he was the very, good doctor, honest man. He used to practice very proper homeopathy, Hahnemannian homeopathy. He used
Mm-hmm.
to, and the doctor I met, the allopathic doctor, he was the nicest one. So they were like gods to me. They were like good teachers to me. So this is how I started having interest in it. So with the cardiac doctor, I was doing palliative care with cardiac patients. So slowly, my patients who had their grandparents in the family suffering from cancer, advanced stages. So for the palliation, they used to ask me, "Ma'am, you also give something." So there, when I started giving medicines, I
Uh,
started getting results, how they're getting better. So then it came to my mind, I will be better if I get a chance to work in a cancer care. So this is what I manifested. So after 2 years, somehow I got to treat during the COVID time. I got to treat an allopathic oncologist for his allergy and fear of coronavirus in the COVID times. And then I met him. I showed him that how many palliative cases I have dealt with. I showed him the videos. So I asked him, why don't you give me a chance to treat away your patients which you send home in your
yeah.
home care? Let's see what I can do. So he just saw that I want to learn and I want to do. So he was also a very, he's also Asia's best doctor, uro oncologist. He got me a chance to work in the hospital as a palliative care physician, homeopathy,
Wow,
and he
wow.
got yes, and it has never happened anywhere in the India even that some homeopathy is having an OPD in the allopathic private hospital.
Mm-hmm.
So I got my OPD in a head and neck surgery department, because in that area people are more, facing more problems with pain and everything, because head and neck cancers are very bad too, because depressing also, because they're open, people can see them, and their intake of food is stopped. There's a lot of pain, and the nerves of the head and neck are very much painful if there are dental problems or anything. So I was placed in that OPD. Then people who were resistant to radiation could not take it more, or had fibrosis, or they had such low state of form that they could not take any more allopathic treatment. They were referred to me. So I started treating them. And then I started getting results, and slowly, it started, getting my confidence at in what cases, what I can do and how much I can do, how much homeopathy can offer, and how much I need to learn more to help them. So this is how I worked there for 3 years completely. And what I thought that I need to totally dip into these kind of cases and then learn and think of what further research is required. So this is what I did. So this right now, these kind of cases I'm getting, I'm trying to, give my best to them.
What a story. What a story. It reminds me of myself. I was, when I finished my studies as a vet, I was the allopath. And then I got sick. I got chronic bladder infections and kidney infections, and nobody could help me. And it was the last antibiotic, and it did not work. And then an assistant doctor said, "Well, maybe try a homeopath." And I
Okay.
was so desperate, so I went to a homeopath. And that homeopath asked me a lot of questions. I did not understand why the moon and why the food. And
Yeah.
in the end, I got the three tiny globules. And I thought, now everyone is crazy. What should that do? And I was so much better afterwards. It
Yeah.
was incredible. So I had to go back and ask, what did you do? How is it called? And where can I learn it?
Hmm.
That was my
Right.
start into homeopathy.
Great. This is how I felt.
Yes, it's the old story like Constantine Hering. He came to prove that homeopathy is wrong, and then he was one of the best homeopaths ever, just because
So,
he got healed by it.
right. So that's why I feel that I was chosen to be a homeopath. That's why I didn't get into the medicine, that kind of medicine.
Hmm.
You know, I now I have a circle. I keep on meeting a lot of allopathic surgeons also. So they will say, "Oh, now I'm a neurosurgeon." But you know, the more intelligent I become, I know there is no need to open the heads. More I'm growing up, I'm able to understand there's no need of opening the heads. And definitely there is a limitation in our pathy that if I'll get a diarrhea, I need to see the gastroenterologist. But you guys, then you know, when I was in the hospital, oncology hospital, people used to come to me, senior doctors. So what is your field? Oh, you treat every kind of cancer. Wow, you are full body specialist. They used to laugh at me because they are, you know, region to region specific they are. And we take up every case. What is the case? Who is the person?
Yes, it's about the
So,
person, not about the
so
diagnosis.
So I'm just in this LMHI I'm joining. So I'll be presenting my work. I'll present a case of a 90-year-old lady. She was suffering from renal cell carcinoma, and
Mm.
she just came to me and I said, nothing can be done. Nothing can be done. I just got prejudiced of myself. Nothing can be done. Only I will try to palliate the symptoms. So first I started with the acute remedies. Then I got her constitution and her story and everything. You know, she continued the treatment for 1.5 years or 2 years, and then her scan got so well that there was a exophytic growth in the kidney. And then the in the fourth CT scan, there was nothing, only small lobules. There was no growth, and still she is living. So we can't here we can't assure you that you'll be fine. We'll see what kind of person you are, what is your background, and you know, you cannot say that every same case will go have the same prognosis.
No,
But
it's depending, and sometimes it's on the divine.
yeah, and it depends on the willpower of the patient a lot many times. People who are positive, they respond very well.
Yeah. So you're finally now sitting in a hospital next to allopaths and fulfilling my dream of allopaths and homeopaths working together.
Yeah, yes, yes. But you know what happened? I just left from the hospital now. I'm
Ah,
doing it full-fledged in my clinic because there, my actions were you know, some people were trying to limit my actions.
okay.
Like, you know, they referred me a case and they had low, this counts, blood counts. So they referred that case to me. Once I started treating them and they were getting better with their blood counts. So again, they were calling them for chemo or immunotherapy. So that time, you know, that time, if I tell them not to go there, then I'm wrong sitting in that place.
Yeah.
So I could not say it to them. And if I'm not guiding my patient with the right kind of suggestion, what I feel, then I'm wrong to them. So it was a mess in my head. It was affecting me. So
I
then I thought
understand
that
very well.
I thought I joined this hospital to gain experience,
Hmm.
not to forever sticking there. I grew up to this level in my clinic only. So now I have gained experience. God has, you know, granted this to me. Now I'll be again sitting in my place where I'll be free to talk my will.
Okay.
So
Eh,
now I have left, but they keep on referring me patients. It's the hospital is nearby, and the doctors are really good who understand homeopathy. They keep on they refer me. Post radiation fibrosis, lot of patients they for cancer cachexia for healing. And a lot of people keep on having mouth ulcers later on,
mhm.
depressions. So they keep on referring patient to me. So
Is
I
there
keep learning,
any,
keep working.
yeah, is there any special kind of remedy that sticks out in patients with radiation problems?
Radium bromide works really well, very good. And it depends, pain is a very personal threshold. Pain threshold is a very personal to everybody. Some people feel radiation, start to feel radiation, side effects of radiation at the 11th radiation only. Some people feel it at 23rd radiation, 30 radiations basically they give. And some people are able to tolerate the 30 radiations even. So some
Wow.
people will have very tight throat. So post radiation, if they have having mucous membrane problems, APIS is a very good medicine. Phytolacca is a very good medicine.
Mhm.
Acid nitric is a very good medicine.
Mhm.
You can always give calendula mother tincture to them in water.
Yes, calendula. You're right.
If they have the affections are affecting the ear, you can always give calimure.
Hmm.
Calimure is very good. And there's a lot of inflammation in the muscles due to fibrosis. Magnesium phosphoricum is very good. 6x.
Hmm. So you go down to the lower potencies in these clients?
Yes, because we are targeting the tissues. So when we are targeting the tissues, so you should start with 6, 3, mother tincture. And
Hmm.
if you get sensation level, if you get symptoms on sensation level, like on pain, then you can go high. But you know what I have experienced with pain, I give LM potency in olfaction. Because sometimes, after morphine also patient keeps on feeling the pain and we give it and the mouth is all covered with cancer and everything. So they can inhale it. So you prepare it and you just try sometime if you have some pain, stomach pain or anything, you make that preparation in the vial for olfaction and you take it. It's very, very effective. Patient will tell you with their gestures. They'll get, are you feeling better? They will say like this. Even I experienced it through them.
Hmm.
Okay, this works so fast and in such a better way. So olfaction also works really well in pain. So I've tried that.
Very nice to hear. Very nice to hear. And how did you come to the London Homeopathic College?
Uh, the thing is, when I was a young child, my mother was a teacher. I never wanted to be a teacher.
Mm.
Okay, because she used to talk so loud and there's a lot of headache. I can't teach. I don't want to take, charge of people who don't want to learn. So, but when I understood homeopathy and and I realized people who are unable to get the right kind of homeopathic treatment at the initial level, they fall into the hands of so bad chronic diseases. So it is the right of every person to get the right treatment at that level. So there is a great need to, spread awareness about this pathy, and there has to be, a lot of people, intelligent people, passionate people who want to learn the art of healing. They should know about homeopathy. So I should be a part of that an
Mhm.
organization who are there to spread this science, and I'm there always with them. So globally, I want to spread it. People should know that it should be the first line of treatment everywhere, and everybody deserves it, and it should be. So I'm part of
Everybody
it. So that
deserves it.
satisfies me. So I'm there with them.
And why London?
While and this is also, I'm teaching this is this college, but I did my post graduation from Henneman College of Homeopathy, London, because
Ah,
I was married. I was married when the time I was getting married, my husband had his job in London. He was
I
a
understand.
hotelier, so he was planning to live there. So I never wanted to lose my work, so I just prepared myself with my PG so that I could work there also. Somehow we could not go there, so I had this PG, and globally I also wanted to interact with people, so I joined LMHI. So London
Mhm.
College of Homeopathy was also, it started in 2017. So I know these people. They approached me. We got to meet each other at LMHI. Then they told me about their uprising project, and I was very much happy to know. So I joined them. Mhm.
Can you tell us a bit about the London College of Homeopathy? Because I think it's a good place to study there
Yeah,
for a
they are running.
European person.
Uh, Actually, we have a very good, teaching faculty. Our main teaching faculty is Dr. Farooq Master, and
Mm.
he has a great knowledge, great clinical experience, and in every way. He understands homeopathy and art of medicine from psychology point of view, from pathology point of view. He's a great teacher and a clinician, and he is the main person in our teaching faculty. And we have other doctors also who have very good clinical practices in that. So we teach with a very clinical mindset, not only theory.
Hmm.
And so we are running two courses there. One is for 2 years and one is postgraduate for 1 year.
Hmm.
So we have groups from Turkey, Poland. We are starting in with Poland, and in UK already we are there, and USA also we are starting. So we want that we should have group of doctors who want to learn it in every country, so that it should spread more and more.
Yes, and sadly, now in Germany, they're thinking of cutting off homeopathy.
I don't understand. Look, homeopathy has survived till now, instead of so much, opposition and critical point of views, but it cannot go away. Cannot
No,
go away.
it cannot go away and should not go away.
It should not.
And,
So
and
that's why we are.
it will survive, I think.
Yeah.
So just think of if 200 years back we needed to go to a doctor. Happily, we both would go to a homeopath and know they can help us. But the poor people who would go to an allopath 200 years ago, oh my God.
Really, in homeopathy, the beauty of homeopathy is that the entire power to treat a person lies in the hand of the physician. Even if a physician wants to charity, I can do it. But if you are dependent on the pharmacy, that they will tell you that after your diagnosis, what medicine you should give, what a handicap you are. So this is the beauty of homeopathy. I know what I have to make for my patient. But in allopathy, they have patents. They will tell you this season you will give this. So
This
what
season,
is there?
yeah,
There's no
this
art.
season you will give this, that. That's exactly it.
Yes, they
Yeah.
do like that. Where during the COVID time I was working in the hospital, so they had 250 beds for COVID patients.
Hmm.
Then I could see that there was only a protocol. They were not realizing who needs what. They were saying, oh, after giving this medicine, how many people had distension in the abdomen, how many people got a heart attack. So they were just writing it down, but they were not accepting that people suffered this and that after this medicine. Ivermectin, I am telling you, ivermectin had such bad, effects on the people, but then nobody accepts. I have a friend who's a veterinary surgeon. He told me that this ivermectin medicine, it used to come in the name of brevomectin, and if you used to give it to the some cattle, if it was not suitable to them, the cattle used to suffer a lot.
Yeah.
Sometimes they could die also.
Yes.
So
Definitely.
So this is, that time I again realized homeopathy was so good. I did not take any vaccination
Mm.
for that. So
Yeah.
because I was running my clinic, I was seeing patients, COVID positive patients I was seeing. Nothing happened to me. I don't
For
know.
me, the same. I'm not vaccinated. I always said a vet can survive everything. We dealt with coronaviruses hundreds of years ago. Why suddenly a vet should get affected by it? I couldn't
Yeah,
see it.
yeah, right. And everybody was saying that it is very difficult to make an RNA vaccine. Then where is your intelligence going that it is going to be, perfect in such small time?
Yeah.
So
So did you yourself get corona then?
I I'll tell you, I just when did I get corona? After corona passed, me and my family, my brother and his wife, we just planned a vacation and short vacation, and we were going, and they both of them were coughing. I said, "You will," because it was mandatory for everybody to get their corona test, then only they can travel. So we all got corona test, and I told them you'll get positive, and then you have to head back. And we were traveling, both of them were coughing and everything. And in the middle of the night, we were in the train, and we just checked the reports. I was positive. I
Hmm.
had no symptoms, and I had no symptoms for the next 15 days, 20 days. I never got any symptoms. They both were laughing at me. They were coughing and they had, mild fever, but I was not having anything. And I was positive. What the hell is it? Nothing happened to me. No, no, nothing. Nothing happened to anybody around me.
Yeah,
So
that's
this
a true
was,
thing. That's a true thing. I got it. I was one day very sick, but my homeopath treated me with camphor in high potencies, and I got well in such an instant. It was incredible.
I, I'll tell you one thing. You know what happens every time, every year during the August and September? This is a season for fevers in Delhi, I could see, in India, every time. And same kind of fever. Some year they'll tell you it's chikungunya. Some years they will tell you dengue. Some years they will tell you COVID. But the fevers are same, you know and they will fever is same. Some people will have it with joint pain, some people will have with it that fever with heavy body, some people will have typhoid. So this is very normal. Every year people who will not live a proper diet and regime will get this for longer days, or small children are going to have it because there is a change of weather. And if we have our Indian system of medicine, Ayurveda, it has chapters that which guide you to have ritu ahar, means special diet for change of season, so that you don't contract disease. So we have 5 seasons, so there is a guideline to have what kind of meal you should have in what season, so that you won't contract diseases. And it is so true there. The things are very, if you follow them, you won't fall sick. So it is
Ah,
very
that's
obvious for me to
interesting.
catch infections in these days. So what I felt, it was my personal feeling that the allopathic pharma is trying to find out a medicine to control fevers. So every year from the time of swine flu, they have started testing their medicines like Tamiflu, uh, in the time, giving it a name. It's swine flu. Tamiflu is being tried. No, 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 it should not have given. Swine flu has no treatment. Just rest. Okay? Because they failed. Then they got dengue. Then they said, oh, platelets get low, because platelets will go low if you will continuously suppress a fever.
Hmm.
So then you have to try, give platelets. Then they will come with a conclusion. No, 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 platelets should not be given. They get a bad effect. Dengue is gone. Then chikungunya comes. Then a new thing for chikungunya comes. And then chikungunya is gone, dead.
Yes, and
And
now
now
the
chikungunya
monkeypox
and
are coming.
everything comes and goes, and then that dangerous disease gets, normal to you, and just you have to just rest. There is no medicine. Now COVID came, people were afraid of getting a sneeze or even slight cough due to the fear of death of COVID.
Yeah.
And now they're coughing here and there, having 102, no problem, because nobody is floating any fear in the air.
Mhm.
So
And
sometimes I feel like that psychologically it affects.
yeah, psychologically it affects. You were talking about these 5 seasons and change of diet. Is this an Ayurvedic principle?
Yes, yes. I look, what I feel is homeopathy is very good when the pathology sets in, whether
Hmm.
mentally or physically, when there is an inflammation, you know, when there is already imbalance of psora, syphilis, and psychotic. But the best preventive medicine happens to be with Ayurveda.
Okay,
Yoga
I
and
understand.
diet regime is best preventive medicine is in Ayurveda. they will tell you how not to fall sick.
Mm-hmm.
Like, there is so much similarity. Like we have Sora, syphilis, and psychotic miasm. In Ayurveda, they have Vata, Pitta, and Kapha. Three. They called it doshas, what
Yeah,
we
yeah,
call
I
miasm.
know.
So this is so similar. This means, truth is universal. So they also had this philosophy. They came up with this.
Ah, I understand. I never thought of that combination, but you are right.
Uh,
Absolutely right. Here in Greece, people eat very seasonally. You know, what the earth gives in the season, this is what they eat, and the
yeah,
herbs that grow around that. And if you do
that
that, you
helps.
stay healthy.
Mm, right. So I had a friend. She was an Ayurvedic doctor. So I keep on exchanging knowledge with her. She keeps
That's
on telling
interesting.
me things and few things to read.
That's very, very interesting. Yeah, I'm
So, but
growing
but
my own.
but the thing with the modern medicine is this, that we are very sure that curcumin helps in healing, and our grandmothers used to give us whenever we used to fall and have, but they want the evidence of a thing which is already proved since ages that it does. So they want the evidence that the air we breathe in, oxygen helps. They want, again, this kind of evidence they are asking for. And
Mhm.
I have been watching their things, evidence based medicine. Now the oncologists are coming with precision medicine. What is precision medicine? Now they've got to learn that they cannot treat everybody under one umbrella. So
Yes,
now through precision medicine, what we know, individualization or constitution, they have just come slightly near, and they got to know there are some genes and few kinds of bodies who tolerate this chemo this much, this chemo this much. So you cannot treat everybody under same medicine. Now they have learned immunotherapy. So later on, after 200 years, they will get to know homeopathy was right. But in the meanwhile, what will happen?
people will try.
Yes, but they're understanding a lot about individualization in oncology
Mhm.
also. That everybody's kidneys are different. If proteins in kidneys are different, they're different people. But they're understanding it as a set of liver and kidney, different set of liver, kidney, and heart, spleen.
No,
But
it's
eventually they will get to know.
yeah. Even if in veterinary homeopathy, it's all about the individual,
Right.
and each animal is different, and each animal has to be treated differently.
Yeah. I know. I was telling you, I have a friend who's a veterinary surgeon. He's
Mhm.
retired and he's treated so many parrots. He treated a parrot who was suffering depression because the owner left the parrot with the neighbors because they had to visit some place. So he got thyroid. He shed his hair.
Oh my God.
And, yeah. So when they came back to see their parrot, he was not ready to speak to them. He was not coming out of the cage to otherwise he used to dance everywhere in the house and used to eat his favorite things. Then they treated him that parrot with acid force 30,
Oh,
and the parrot got improved, and I could see the picture changes. Then after 3 days he was eating something and very active. So this is very interesting. And cats also, after hysterectomy, I've treated so many cats with lachesis. They have responded. We have a lot of, nowadays dogs are getting a lot of vaccination. So lot many
yes.
times I have to treat them with tuja, silesia, and lot many medicines, and they're getting, psychic also. They're banging their heads in the walls after, lot many dogs are getting so much affected with that because so many injections are being given nowadays to the dogs. So
It's
they're
over
having,
vaccination. It's definitely over
yes,
vaccination.
getting rectum prolapse and so many things. So epilepsy cases, lot of epilepsy cases with
Yes.
cupramet or impotencies we have seen. Dogs are improving. It's again a great field. People who can understand dogs or cats, or you have to understand. You should be able to understand by their body language. You should be an expert. Then homeopathy works really well. We could
Mhm.
see.
Yeah. It's in children the same. Those
Mm.
who don't talk, they talk with their body, they talk with their hearts, they talk with their souls. You just have to
And they
understand.
don't manipulate.
Hmm?
And the animals don't manipulate.
They don't manipulate, they don't lie. Except if you might find a Druja dog that might lie
Okay,
intentionally,
that's interesting.
but that's a symptom.
Hmm. You
Yeah.
must be understanding.
Is there anything else you would like to tell our listeners? Anything
Uh,
we missed out on? Anything that you say, oh, this is very specific for me or my way to deal with homeopathy? Or would you just encourage everybody to try it out?
yes, I would love to encourage everybody to try it out.
Because I think this is the common thing between us two. We had to try it out and we got very much convinced by it.
Yes,
And then, of course, you want to have the same possibility for the others to get that experience and to see what's possible.
right.
When I broke my ankle, I got arnica in a very high potency, and I drove my car again after 3 days. I never had a cast. I only had my ankle taped.
Great. This is all these results, they just put these words in our mouth that we call it a miracle. Oh my God, it's a miracle.
It looks like it, but it's action of homeopathy.
Right. This is so dynamic, so dynamic.
And
So the thing is, if you want to keep healthy, you have to keep your, you know, mindset positive and healthy. Think good, feel good. If you are having things in your life to hide, to feel shameful about, then you will definitely develop some pathology. So for that you need to exercise. You don't need to delay things. Do your duties every day. What you cannot handle, just speak out, and don't, if you're not able to do it, don't take up any pressure. And you mentally, if you are a tension free person, you will get less diseases. If mentally you have a lot of problems, any of your emotion, whether it is hate or it is jealous or it is worry, if any of your emotion grows more than the required thing for a longer time, it is going to give you something in the starting itself with a functional change. And from there itself, you'll get a homeopath. So then you will prevent a lot of things.
definitely, and always go for the conflicts, always confront, don't hide them.
Right.
So I have the same experience. That keeps you healthy. Thank you very much, Dr. Mini. It was a pleasure to talk with you. I hope we
And
can
same
talk
here.
again sometime. And I
Sure,
wish you
sure.
very well and just go on going to be a very famous doctor.
Thank you. Thank you. Thank you for your wishes. I'm so happy to speak to you today.
Me too. Me too. So thank you very much and till the next time.
Okay.